A report by community-led monitoring group Ritshidze features a detailed outlook into the state of the public healthcare system in KwaZulu-Natal. The report has revealed several challenges that are disruption to access to health facilities by people living with HIV in the province. Even improved access to some services appears to be leaving some communities behind, including the LGBTQIA+ community, people who use drugs and sex workers. Joining us now to discuss the report's findings is the Ritshidze project coordinator, Ndivhuwo Rambau. Ndivhuwo, very good afternoon. Appreciate your time this afternoon. Now, a number of improved services for people living with HIV in KZN have been noted. So there is some progress based on your study.
Yes, thanks, Hugo, and thank you for having us this afternoon. So this is basically the second edition of the State of Health report for KZN. We launched the first edition last year at about the same time, and now we're just coming back to get a sense of what has improved, what has gotten better, and what still needs to be improved. So overall, the indicators or the areas included waiting times, staff attitudes, as well as ARV refills. And if you look at waiting times, these went down compared to last year by about 41 minutes as well.
So 41 minutes obviously is a significant number. But people are still waiting anything from 2.5 to 3 hours. What is the ideal waiting time?
So the ideal waiting time in facilities, and you find that this is like pasted on some clinic walls, for example, when you visit a facility, where others will say about 3 hours is the ideal waiting time, or the waiting time that you would wait in that specific facility when you are going to visit it. But KZN has done quite well in this indicator or this area compared to other provinces that we monitor in, where we have patients waiting for as long as 6 hours at times to access their services.
Now, you did talk about the quality of service that patients are experiencing when they go into any number of these facilities, and that a significant percentage has gone up, and the service is good. But that's for the one group. There are other minority groups, such as those in the LGBTIQI+ community, that feel differently.
That is indeed true, Hugo, and this was also witnessed at the community meeting in itself, where we had several key populations coming in to also give their testimony on how they feel that they're treated at facilities. I think a key thing that was raised was around the issues of lubricants, and even in our data we're finding that lubricants are only available in about 26% of sites, and in any case and in most instances lubricants aren't put in public where people can just go and access them if they need them. We feel that lubricants should be put in bathrooms where, if it's a private space where you can just go and take as much lubricant as you want without being judged. In most instances, you have to ask a nurse that, I need lubricant, I'd like some lubricant, and then you start getting questions about all your sexual behaviors and what kind of activities are you, engaging in that would need you to get so much lubricant or access so much lubricant.
I suppose it's no surprise, because KwaZulu-Natal is by and large a very traditional province, if you will. And according to your data, it is also the least friendly in this regard. How would you deal with this situation? Is there need, do you think, to deal with the stigma, to create more advocacy and awareness about what is nationally acceptable?
Most definitely, there is a need to advocate around the issues for key populations, especially because we might look at the context, but key populations live and exist everywhere. There isn't a specific place where you might find KPs. KPs are situated around the country, basically. And, we have experiences of trans people who are wanting to access their hormonal treatment at facilities, where we've got about 54% of trans people who would like to access those hormones. So as Ritshidze, one of our key recommendations has been that let's open up centers of excellence, drop-in centers specifically, where key populations can go in and access the services that they need. Currently, you'd find that there's about 2 drop-in centers where people who use drugs can access methadone. And if you live in a very far away rural village and you don't have money to, go and access those services at the drop-in center, it becomes very difficult to even access them. So if we have centers of excellence or drop-in centers that are actually situated where KPs can actually access them, that will go a far way in ensuring that KPs are also sorted out in terms of services. And those drop-in centers should also be led and run by people who are key population friendly. So peers and advocates should be working in that space so that key pops can also feel very welcomed when they come into the space.
So what is the conversation that you are having with the Department of Health in KZN around this specifically? Because it obviously is a bigger issue in KZN than it is in any other province in the country.
So the department in itself did commit to, several of the recommendations that Ritshidze has come up with, and they also shared with us some of the plans that they have put in place, which we will obviously, start monitoring in the next year as we continue with our monitoring to see if the attitudes and perceptions towards key populations do actually improve with all of the plans that they've put in place.
Now, one of the things that you also picked up was the staffing levels within the KZN province, and I think there are vacancies as high as 400 that have not been filled in the last 12 months since you did your initial report. What has the reaction to this statistic been? Do we know why those vacancies have not been filled?
There is acknowledgement from the department that indeed those vacancies do exist, and there are plans that have been put in place to not only fill the positions but also fill up the skills gap as well. So that is one commitment that the department has made, and they have noted that it is something that is occurring in the province.
Okay, so we've talked about key populations that are affected in this province. There are obviously other groups, people living with HIV, for instance. Have you made progress in this regard? Are there any challenges, room for improvement?
I mean, there has been an improvement compared to last year's report. Positively this year, many more people living with HIV reported a 3 to 6 month refill. So this is up from 31% to 49% this year. And getting people to get longer ARV refills basically means that the clinics aren't as congested, because there's no need for you to be going every single month to go and collect your treatment, something that you would get there and probably sit and wait the whole day for, just to get a small packet of ARVs and go head home. So getting more people to receive a longer ART refill means that you don't need to keep on going to the facility. And at that time, it's an already burdened facility at the time. Staff members are also exhausted. They are fatigued because they have to see so many people. And we've also urged the department to decant more people out of the facilities into your CCMDDs, where people can collect their treatments at Clicks, at Dischem, or whatever the case may be, and only go to the facility once a year, basically, to take their annual meds, as well as, get some tests done. But other than that, if you've got your 6-month refill, it only means that you visit the clinic once, or if you have some kind of flu or you just feel ill, and that's when you would need to go to the clinic.
Now, when you look at PEPFAR-supported countries, and South Africa is one of those countries, 80% is sort of that mark that they've been able to achieve, where individuals have HIV and AIDS. Where are we sitting at the moment in South Africa, or in KZN in particular? And how far do you think we have to go before we get to that 80% mark?
In KZN, according to the data for this year, we're sitting on 49%. Within the whole of Ritshidze, all the provinces that we monitor, the province that did the best is Mpumalanga. Mpumalanga was sitting at 59% of people living with HIV getting a 3 to 6 month refill. And I think if we can just improve some of the things that we're seeing in the facilities, the challenges that people are facing, for example, getting people in and out of the facilities as quick as possible, reducing our waiting queues, ensuring that people feel safe while they wait outside facilities as well, goes a long way in actually getting people to stay on their treatment as well.
Now, you looked at 131 facilities in the province. Against how many facilities in the entire province will be the first part of the question. And the second part of the question is, how accurate are your numbers when we take into account what's transpired last year, so the 2021 protests in July last year, and obviously the flooding that has occurred, displacing thousands of families?
So in terms of the accuracy of our data, we do our monitoring on a quarterly basis. So you could say that in a year we monitor the clinic or the clinics that we are looking at about 4 times. And the data that we used here is from our Q4 data. And we basically compared the same quarter against the same quarter in the same year. We also managed to collect data that's related to the floods, where we found about plus minus 21 of our facilities had been affected by floods. 2 of them had been closed for about 2 days or more, and we have 1 that is still currently closed at the moment. So there was quite a lot of advocacy that had to go into ensuring that those patients are able to access their treatment or be referred to other close-by facilities.
Now, one positive that I did pick up in your reports is around cleanliness, and 77%, I think, of the respondents said that the facilities were generally acceptably clean. So obviously this is a positive. Is this where that mark should be, or is there obviously room for improvement?
I mean, overall, the province performed the best this year as well as last year amongst all of the provinces that we monitor, and we currently monitor about 8 of the provinces in the country. Definitely, it's 77% of public healthcare users who reported that the facilities were very clean. So if we can at least, push it even more to get 90% of healthcare users being very happy with and satisfied with the cleanliness, then that would be great.
Now, final question before we let you go. We did note during the 2 years that we were under COVID that there was a certain amount of despondency amongst healthcare workers. Obviously, the amount of pressure that they had to deal with during that time was absolutely incredible. Have you seen an improvement since COVID has died down to some degree?
We have seen some improvements. However, we've seen that COVID-19 and TB infection control are 2 things that can actually be in parallel with each other. We saw during COVID-19, as patients, we would always go to the facilities wearing our masks and ensuring that, if you're coughing, you would be put to the side and everything. So we could see that it is possible for us to have very good high levels of TB infection control in the facilities if we were able to maintain that during COVID. So even with now, we're asking that, within the facilities to ensure that, there's the TB infection control, that windows be open, people who are coughing should be, separated from everyone else in the waiting rooms and so on. And also there has been a decrease in, people saying that they're able to access their treatment. And I mean, during COVID, there were also quite a lot of privacy issues that came up where people were getting, treatment outside gates, for example, and you would just be given your bottle and everyone could see your ARVs and say, oh, you're actually HIV positive. So we have seen a reduction in reports around issues of privacy and so on.
Ndivhuwo, I appreciate your time this afternoon, and obviously glad to see that some progress is being made year on year. Ndivhuwo Rambau speaking to us, and she represents the community-led monitoring group Ritshidze.